Skilled Nursing Facility Benefit, April 2017. Agenda: Overview of Skilled Nursing Facility Benefit, or SNF, Covered SNF Services, Coverage Criteria, SNF days in the Medicare benefit period, Non-Covered level of care, Resources, Q&A. This is the agenda for today's training. Skilled nursing facility care is health care given when a Medicare beneficiary needs skilled nursing or therapy staff to manage, observe, and evaluate their care. Examples of skilled care include intravenous injections and physical therapy. It is also referred to as extended care services. Most facilities are certified both as nursing facilities and as skilled nursing facilities. Nursing facilities beds are typically occupied by Medicaid beneficiaries or patients needing non-skilled care. Most nursing home care is custodial care. Custodial care is care that can be given by non-professional staff, like help with bathing or dressing. Medicare does not cover custodial care. I would like to point out that people don't usually stay in a SNF until they're completely recovered, because Medicare only covers certain SNF care services that are needed daily on a short-term basis. A skilled nursing facility, or SNF, is a facility which provides rehabilitative care to Medicare beneficiaries post-hospital inpatient care. CMS certifies these facilities. This process is handled through the Division of Survey and Certification, and certification includes a survey being completed by the state. A SNF can be identified by their provider number and their type of bill, or TOB. Provider number range XX-5XXX through XX-64XX and TOB SNF Inpatient 21X. A swing bed provider, which we will discuss in more detail on the next slide, follows SNF coverage criteria and guidelines. A swing bed can be identified by their provider number and the type of bill. Provider number range XX-UXXX, XX-WXXX LTCH, XX-YXXX Rehab Hospital, XX-ZXXX CAH or CA, and TOB Swing Bed Inpatient 18X. Both a SNF and a swing bed provider have the staff and equipment to give skilled nursing care and/or skilled rehabilitation services and other related health services. A SNF can be part of a nursing home or a hospital. Certain hospitals and critical access hospitals, or CAHs, who have approval to furnish swing bed services may use their beds as needed to furnish either acute or SNF level care. This increases Medicare patient access to post-acute SNF level care. They may use any acute care bed within the hospital or CAH for the provision of swing bed services, with the exception of acute care beds within their inpatient prospective payment system, or IPPS, excluded rehabilitation or psychiatric distinct part unit in an intensive care type unit, or for newborns. The requirement for hospitals are that they are located in a rural area, have fewer than 100 beds, and that they have a Medicare provider agreement as a hospital, and they are compliant with SNF participation requirements. A critical access hospital is required to have no more than 25 inpatient beds. When swing beds are used to furnish SNF-level care, the same coverage and cost-sharing rules apply as though the services were furnished in a SNF. This means that services provided in the swing bed are subject to the same Part A coverage, deductible, coinsurance, and physician certification recertification provisions that are applicable to SNF extended care services. Hospitals offering swing bed services, excluding CAHs, are paid for their SNF-level services under the SNF Prospective Payment System, or PPS. The SNF PPS covers all costs ancillary, routine, and capital related to covered services furnished to Medicare patients under a Medicare Part A covered SNF stay, with the exception of certain specified services that are separately billable under Part B. Critical access hospitals, CAHs, that offer swing bed services are paid for their SNF-level services based on 101% of the reasonable cost of the services. This is a summary of the requirements to be eligible for the Medicare SNF benefit. We will go over each of these requirements in detail on the upcoming slides. In order for a Medicare fee-for-service beneficiary to qualify for post-hospital extended care services, the individual must have been an inpatient of a hospital for a medically necessary stay of at least 3 consecutive calendar days. In addition, the individual must have been transferred to a participating SNF within 30 days of the hospital discharge, unless the patient meets the exception rule. Medicare-covered skilled care services involves safe and effective care given by skilled nursing or rehabilitative staff. It includes semi-private room, meals, skilled nursing services, skilled rehabilitation services, OT, PT, SLP, medications, medical supplies and equipment, dietary counseling, ambulance transport to receive services not offered by SNF. Medicare does not cover custodial care. All of the criteria listed here must be met in order for Medicare to cover SNF care. The beneficiary has Medicare Part A hospital insurance. SNF benefit days available to use, we will talk about these in more detail. 3-day qualifying hospital stay, which we will discuss on the next 2 slides. SNF services related to medical condition treated during 3-day qualifying hospital stay or for condition that arose during that SNF stay. Generally, the beneficiary must enter the SNF within 30 days of leaving the hospital. A doctor has ordered the inpatient services SNF services, reminder, which require the skills of professional personnel like registered nurses, licensed practical nurses, physical therapists, occupational therapists, speech-language pathologists, or audiologists, and are furnished by or under the supervision of these skilled personnel. The beneficiary requires skilled care on a daily basis, and the services must be ones that can only be provided in a SNF on an inpatient basis. Skilled rehabilitation services are considered a daily care event if it is only offered for just 5 or 6 days a week. One of the coverage requirements for SNF care is a qualifying hospital stay. This means a medically necessary inpatient hospital admission of 3 consecutive days or more, starting with the day the hospital admits the beneficiary as an inpatient, but not including the day the beneficiary is discharged from the hospital. Note, the hospital discharge must have occurred on or after the first day of the month in which the individual attained age 65 or became entitled to health insurance benefits under the disability or chronic renal disease provisions of the law. The hospital needs to be a Medicare-certified hospital or institution that meets conditions of participation for emergency services hospital. The hospital stay can be a total of 3 consecutive days in one or more hospitals. The time spent in the ER or in observation are considered outpatient services. We see quite a lot of inquiries questioning the denial of SNF services because the beneficiary or their family thought they were inpatient when in fact they were receiving observation services. Hopefully, with the implementation of Medicare Outpatient Observation Notice, or MOON, effective in March, patients and their families will have a better understanding of their status as an outpatient, not an inpatient, and the implications of such status. SNF services must be for treatment of condition for which the beneficiary was receiving while an inpatient at the hospital. Foreign hospitals may satisfy the 3-day qualifying stay criteria. The SNF would need to submit documentation to the MAC, including an itemized bill or medical report showing the dates of service, a description of the illness, and or any other information that is available. the MAC will contact their regional office for a determination of whether the 3-day stay criteria has been met or not. There is an exception to the 3-day qualifying hospital stay criteria. If a beneficiary voluntarily or involuntarily disenrolls from a Medicare Advantage MA plan while an inpatient of a SNF and converts to original Medicare, i.e. fee-for-service, the requirement for a 3-day hospital stay will be waived if the beneficiary meets the level of care criteria. The SNF would need to submit their claims with Condition Code 58 to identify this exception. If the beneficiary voluntarily disenrolls from a risk MA plan and converts to original Medicare, i.e. fee-for-service, before admission to a SNF, then the beneficiary must meet all original Medicare requirements for a SNF stay, including that of a 3-day inpatient hospital stay. What can a Medicare beneficiary do if they do not have a 3-day qualifying stay and they need skilled care in a SNF? They can be advised of their appeal rights and that the appeals process has 5 levels. Ask if they have long-term care insurance that might provide coverage, or if they have a supplemental plan that help cover the cost, and or they can try to negotiate with the SNF for a private pay rate. The next requirement is the beneficiary needs to be transferred to the SNF within 30 days after discharge from the hospital. In other words, the qualifying stay must take place no more than 30 days prior to SNF admission. If the patient leaves the SNF and returns to the SNF within 30 days, the original qualifying stay counts towards satisfying the 3-day hospital stay criteria. If the patient's level of care drops, no longer needs daily skilled care, and they return to a Medicare-covered level of care, LOC, within 30 days, no additional 3-day qualifying stay is needed. They can use the original qualifying stay. The extended care services must be for the treatment of a condition for which the beneficiary was receiving inpatient hospital services or a condition which arose while in the SNF for treatment of a condition for which the beneficiary was previously hospitalized. An elapsed period of more than 30 days is permitted for SNF admissions where the patient's condition makes it medically inappropriate to begin an active course of treatment in a SNF immediately after hospital discharge, and it is medically predictable at the time of the hospital discharge that he or she will require covered care within a predeterminable time period. An example, hip fracture. Under the established pattern of treatment of hip fractures, it is known that skilled therapy services will be required subsequent to hospital care, and that they can normally begin within 4 to 6 weeks after hospital discharge, when weight-bearing can be tolerated. Under the exception to the 30-day rule, the admission of a patient with a hip fracture to a SNF within 4 to 6 weeks after hospital discharge for skilled care, which as a practical matter can only be provided on an inpatient basis by a SNF, would be considered a timely admission. When complications require a delay in the medically predictable time frame, services may be covered if care begins as soon as medically possible. For example, an amputee is scheduled to start rehabilitation services to use a prosthetic 6 weeks after amputation. They get an infection which delays recovery time, which in turn delays the rehabilitation start date. This is a highlight of points regarding SNF readmissions. Post-hospital extended care is considered covered if a Medicare beneficiary leaves a SNF and is readmitted to the same or any other participating SNF for further covered care within 30 days of the last covered skilled day. The 30-day transfer requirement is considered to be met. The same is true if the beneficiary remains in the SNF to receive custodial care following a covered stay and subsequently develops a renewed need for covered care there within the 30 consecutive days. Thus, the period of extended care services may be interrupted briefly and then resumed if necessary without hospitalization preceding the resumption of SNF coverage. Payment for covered post-hospital extended care services may be made only if a physician makes the required certification at the time of admission, or as soon thereafter as is reasonable and practicable. And where services are furnished over a period of time, the required recertifications need to be completed. The certification or recertification statement indicates that the beneficiary will need daily skilled covered care, and it must be signed by the attending physician or a physician on the staff of the skilled nursing facility who has knowledge of the case, or by a physician extender, that is, a nurse practitioner, NP, a clinical nurse specialist, CNS, or a physician assistant, PA, who does not have a direct or indirect employment relationship with the facility but who is working in collaboration with the physician. Only physicians may certify PTSLP services. Routine admission orders are not acceptable. Skilled level of care refers to health care given when you need skilled nursing or rehabilitation services to treat, manage, observe, and evaluate your care, generally for short periods of time following hospitalization, provided to improve condition, therapy within predetermined time period, or maintain current condition to prevent it from getting worse, provided in SNF directly by or under supervision of skilled professionals, registered nurses, licensed practical and vocational nurses, physical and occupational therapists, speech-language pathologists, and audiologists. Skilled nursing services or skilled rehabilitation services, or a combination of these services, must be needed and provided on a daily basis, i.e., on essentially a 7 days a week basis. A patient whose inpatient stay is based solely on the need for skilled rehabilitation services would meet the daily basis requirement when they need and receive those services on at least 5 days a week. If therapy services are provided less than 5 days a week, the daily requirement would not be met. The SNF coverage rules we have been discussing do not apply to beneficiaries enrolled in a Medicare Advantage organization. The claims for beneficiaries enrolled in an MAO plan should be submitted to the MAO and not traditional Medicare contractors. Once the MAO pays the claim, they submit it to traditional Medicare. It is submitted as a covered claim with CC04 for tracking purposes. CC04. Patient is a member of a Medicare Advantage MA plan. Providers report this code for information-only purposes to correctly report benefit period utilization to the Common Working File, or CWF. When a beneficiary is enrolled in hospice and they receive services related to their terminal illness, the claims for those services should be submitted to the hospice agency. Any services they receive that are not related to their terminal illness should be submitted to Medicare with a condition code CC07. CC07. Treatment of a non-terminal condition for a hospice patient. Report this code when the patient has elected hospice care, but the provider is not treating the patient for the terminal condition. SNF coverage does not include home health services because it is not a valid site for home health care. SNF days in the Medicare benefit period. A benefit period is a period of time for measuring the use of hospital insurance or extended care services benefits. It is a period of consecutive days during which covered services furnished to a patient up to a certain specified maximum amount that may be paid for under Medicare Part A. For example, a patient is eligible for 100 days of extended care services during a benefit period. The benefit period was created to track the benefit days a Medicare beneficiary has used. You may have also heard of the term utilization or spell of illness. Although a hospital and a skilled nursing facility have separate days to use, they are connected by the same benefit period. The benefit period can carry over to the next calendar year, but unused benefit days are not carried over to the next benefit period. Diagnoses do not affect benefit period determination. A benefit period begins with the first day a patient is furnished inpatient hospital or extended care services by a qualified provider in a month for which the patient is entitled to hospital insurance benefits. When there is an exception to 30-day transfer rule where more than 60 days have passed and the medically predictable time frame exception is in play, a new benefit period would be generated with the SNF admission. A new qualifying hospital stay is not required. 100 SNF days would be available. Since we talked about how the hospital benefit is tied into the SNF benefit and the benefit days are included in the same benefit period, you may be interested to know that under Medicare Part A, 150 inpatient hospital days are covered. After the beneficiary uses their 100 SNF days, or once the patient drops below a Medicare-covered level of care, Medicare will no longer pay for services until the current benefit period ends. When the beneficiary begins a new benefit period, the SNF benefit days renew, and the patient has a fresh set of 100 days in the SNF benefit. A benefit period will end in the following situations. The benefit period ends with the close of a period of 60 consecutive days during which the patient was neither an inpatient of a hospital nor of a SNF. To determine the 60 consecutive day period, begin counting with the day the individual was discharged. Providers sometimes call this facility free. If the patient is admitted to any other facility or even the same facility within those 60 days, they are still within the same benefit period and will continue to use any remaining benefits or remain in a benefit exhaust status. That benefit period stays active until they remain facility-free for 60 consecutive days. For SNF inpatients, beneficiaries who remain residents in the SNF, when their level of care drops below a Medicare-covered skill level for 60 consecutive days, the benefit period would end. Ending a benefit has also been referred to as a break-in spell of illness. A beneficiary can have a benefit period in a SNF that may last for several years. This happens if the beneficiary never changes to a lower level of care. They are at a skilled level of care but have exhausted their benefits their 100 days. If they never drop in level of care, continue to need daily skilled care, and they are not discharged, they will remain within that benefit period. An inquiry that comes up quite often is when a beneficiary remains in a SNF receiving non-skilled care. What happens if they require skilled care again? If their level of care returns to a Medicare-covered level again while they are still an inpatient in the SNF, but past the 30-day transfer requirement, they may be eligible for a new benefit period, but they cannot access any SNF benefits because they cannot meet the 3-day qualifying hospital stay and 30-day hospital transfer requirements. A beneficiary can access the 100 days of SNF benefit as long as they have met coverage requirements. Medicare covers up to 100 days per benefit period. Days 1 through 20 are full payment days. Medicare pays 100% of Medicare-covered charges. No beneficiary coinsurance amounts are applied. Days 21 through 100 are coinsurance days. Medicare pays 80% and the beneficiary pays a daily coinsurance amount. Day 101 and beyond are benefit exhaust days. Medicare makes no payment. Dates of death, discharge, or leave of absence are not counted as SNF days. Once a beneficiary has used their 100 days, this is known as benefits exhausted. Medicare no longer will pay for the inpatient SNF services. When the beneficiary in a Medicare-certified SNF is not entitled to Part A benefits, limited benefits are provided under Part B. When no Part A program payment is possible, some or all services may be medically necessary and can be covered as ancillary services under Part B. The services may be billed by the SNF or the rendering provider or supplier under an arrangement with the SNF. A few examples are diagnostic X-ray tests, diagnostic laboratory tests, and other diagnostic tests. X-ray, radium, and radioactive isotope therapy, including materials and services of technicians, surgical dressings and splints, casts, and other devices used for reduction of fractures and dislocations. As a reminder, in order to qualify for a new benefit period, the beneficiary would have to be out of any Medicare-certified inpatient facility for 60 days, or if still a SNF inpatient, not receiving any skilled care for 60 days in a row. These are some questions to ask or information to check if you receive an inquiry regarding a Medicare beneficiary's extended care services SNF not being covered. Does beneficiary have active Part A coverage? Does beneficiary have active Part B coverage? Needed for services covered under Part B, e.g., preventive services, is SNF admission date within 30 days of 3-day qualifying hospital stay? Does beneficiary have SNF days available? Non-covered level of care. In a non-covered level of care situation, the Medicare beneficiary is no longer receiving skilled care. A SNF ABN is a CMS-approved model written notice that the SNF gives to a Medicare beneficiary or to his or her authorized representative before extended care services or items are furnished, reduced, or terminated when the SNF, the Utilization Review (UR) entity, the QIO, or the Medicare contractor believes that Medicare will not pay for or will not continue to pay for extended care services. The skilled nursing facility must advise the beneficiary orally or in writing. The use of occurrence code 22 with the beneficiary's last Medicare-covered day on the Medicare claim will allow CWF to start the count for a new benefit period. The use of the occurrence code 22 and the associated date will start the clock to count for a period of 60 days during which the patient was neither an inpatient of a hospital nor of a SNF. SNFs must give a SNF ABN whenever a triggering event occurs. A triggering event is defined as one of 3 changes to services: initiation, reduction, or termination, and it is believed that such services do not meet the medical necessity guides for Medicare coverage. A. Initiation of services. In the situation in which a SNF advises a beneficiary that it will not accept the beneficiary as a Medicare patient because it expects that Medicare will not pay for the extended care items or services that a physician has ordered, the SNF must provide a SNF ABN to the beneficiary before it furnishes extended care items or services to the beneficiary. B. Reduction of services. In the situation in which a SNF proposes to reduce a beneficiary's extended care items or services because it expects that Medicare will not pay for a subset of extended care items or services, or for any items or services at the current level and or frequency of care that a physician has ordered, the SNF must provide a SNF ABN to the beneficiary before it reduces items or services to the beneficiary. C. Termination of services. In the situation in which a SNF proposes to stop furnishing all extended care items or services to a beneficiary because it expects that Medicare will not continue to pay for the items or services that a physician has ordered, the SNF must provide a SNF ABN to the beneficiary before it terminates such extended care items or services. The beneficiary has the right for an immediate review. SNF ABN must include date Medicare coverage will end, why services are not or no longer covered, estimated cost of covered care, right of beneficiary to request SNF sends claim to Medicare for official payment decision. This is called a demand bill. When a demand bill is requested, the beneficiary is not required to pay for their SNF services until a decision is made. Coinsurance still applies and cost of services not covered by Medicare. The beneficiary is responsible for the cost of stay if Medicare upholds SNF ABN. Right of beneficiary to appeal decision with expedited review, QIO contact information, appeals deadline. Signature line to verify notice was received. beneficiary has the right for an immediate review of the SNF's decision if they or their authorized representative do not agree with the change in level of care. The QIO program is one of the largest federal programs dedicated to improving health quality for Medicare beneficiaries. They handle cases in which beneficiaries want to appeal a healthcare provider's decision to discharge them from the hospital or discontinue other types of services such as extended care services. The QIO reviews the case and decides whether continued skilled services is reasonable and necessary. The beneficiary can submit additional information to QIO to support their belief that skilled services are needed. Here are some resources for SNF coverage criteria and benefits.